much you may have heard before, chemotherapy and radiation, but today we're going to talk about how those treatments are used in the care of a brain tumor. And joining me to discuss that right now are Dr. Nicholas Mitras and Dr. Joanna Emelo. Doctors, thanks so much for joining us today.
Thanks for having us.
So let's draw the distinction first between the two, chemotherapy and radiation. For those who may be uninitiated, what are they and what are the differences between the two?
You want to start?
Sure. So radiation is X-ray therapy directed at or targeted at the area where the tumor was removed or where the tumor is. It's painless. It's usually done in a daily format, about 15 minutes into the day, over varied numbers of weeks. Definitely different in terms of the time intensity with the chemotherapy component. But radiation can be thought of as more as a focused form of treatment, something similar to surgery.
I think with chemotherapy, TV has taught us that chemotherapy is going to be this yellow bag hanging and the patient hooked up to an IV line, but that's not always what it is. A lot of times our chemotherapies can be given in the comfort of your own home in the form of a pill. We have a number of different chemotherapies that have been FDA approved and also experimental chemotherapies being used to treat brain tumors, usually delivered in cycles, and we'll walk each patient through the specific kind of chemotherapy that we're going to give them so they're up on what kind of side effects to expect.
So in terms of how long a chemotherapy treatment may take, it really depends on what you're being treated for, right? And the type of chemotherapy you're receiving.
Absolutely. And sometimes the chemotherapy will be given in cycles, and sometimes it's given in conjunction with the radiation.
So we talked a little bit about, does it hurt, does it not hurt? Dr. Emelo, you mentioned pain is really not part of it. But are there other side effects? If not pain, are there other things patients need to know about before they receive something like this?
Common side effects from radiation include fatigue, hair loss in the area that we're delivering the treatment, and they can get headaches and maybe even some nausea over the course of treatment. Usually we're visiting with the patients at least weekly, at least once weekly, if not on a more frequent basis in order to manage those symptoms.
And we'll always walk patients through the specific side effects of the chemotherapy that they're being given so they know what to expect. And we also try to emphasize that side effects are not necessarily things that you're going to have, but things that could happen just so that you know what to expect. Given temozolomide is one of the more common chemotherapies that we use. It's a pill, and the two most common side effects there are fatigue and nausea. But you take the medication at night and you take an anti-nausea pill right before you take your chemotherapy. Then that way we're able to take care of the two most common side effects even before you get a chance to experience them.
Side effects are a part of the consideration around the question I'm sure you get frequently around this, which is what happens to my quality of life? What are the types of ways in which this will impact my day-to-day? Are there nutritional things that people need to keep in mind? What is the sort of day-to-day reality of patients who are on these drugs? What are some things we need them to remember before they do that?
For most treatments, I actually encourage the patients to keep their regular activities as normal as possible.
Work and everything too?
Try to continue living as normal as possible, be as active as possible. The more you do, the more you feel like doing, the more you can continue doing. I really try not to restrict them.
On the chemotherapy side, what about that?
Same goes for chemotherapy. By and large, these are very well-tolerated treatments, and they've been studied in order to make it so. And so we give those side effects as things that could potentially happen, but again, not necessarily things that are going to happen. And usually people are able to get through the majority of their day and almost a reminder at the end, oh, that's right, I have to take my chemotherapy at night. So I think one thing that brain tumors we really have going for us is that our chemotherapies are very well tolerated.
Excellent. All right, folks, so again, radiation and chemotherapy, two things you may have heard a lot about, but a lot of nuance too, so thanks so much for watching. If you have any other questions about these, please be sure to check in with your primary care physician, your healthcare team, whoever you may be working with from a healthcare provider standpoint, and they can certainly help shed some light. So thanks so much for watching, and we'll see you next time.